I just want to talk about how someone goes about getting a living kidney donor. I mean, I can imagine they would think about their family and their friends and their colleagues, but it seems, it's a big ask, and it seems like it could even be a difficult task. So how would someone go about starting that conversation?
So a very important message is that people don't realize is that it's not like bone marrow transplant where the matching and the closeness of the match is critical. There's a degree of matching which has to occur. Mm-hmm. You need to be of a compatible blood group, and there needs to be a situation where the person who needs the kidney doesn't have any antibodies in their blood against the donor. If those two conditions are satisfied, then the degree of matching isn't that important. We can get away with less good matching because of our anti-rejection drugs. So flipping it around, as long as you're not incompatible,
right,
then it's good enough. And so there are a lot of people out there with whom you're not incompatible, with whom you are actually compatible enough to get a kidney transplant. So sure, the best match would be if it's your brother, but even somebody who's unrelated to you, even a stranger, may be very well compatible with you. And so these days we've definitely seen less of an emphasis on family donations, less of an emphasis on siblings, more of an emphasis on friends, and even more extended relationships. Work friends, even people who are through social media, who are friends, but are willing to do this. So the potential for donation, the people who will come forward, it always amazes me about who's good,
Well, there's anonymous donors too.
Yeah,
I mean, that is
absolutely.
What you're saying is the circle can be quite wide for people.
That's
looking.
right. So I encourage people to consider a wide circle. It's true that probably your closer circle are the most likely ones to do it. But if you don't have anybody in your close circle who is able to do it, then it's a good idea to look more widely. Now, how do you ask somebody to do this?
That's a whole other question.
That's
isn't
a
it?
big,
the big ask.
It's a big ask,
Yeah.
and we feel very strongly that patients need to be educated and to raise awareness within them about safety of living donation, and then get tips actually, on how to make the ask. So we have printed material, we have sample letters. We'll work with somebody to devise a strategy of how they're going to reach their community, and it'll be different things for different people. Even for some people, younger people, they communicate with their friends on social media. Social media might be the right answer.